Section 1, Introduction. This section includes definitions, understanding how harassment and bullying occur. Registered practical nurses have long voiced their concerns about the risks of violence in their many types of workplaces. Violence can occur from patients, clients, residents, families, visitors, other nurses, or other healthcare providers. National Survey on the Work and Health of Nurses, conducted in 2005. Practical nurses were more likely to report having experienced physical assault by a patient in the past year than other categories of nurses. 39.4% of RPNs reported being physically assaulted at work by a patient in the last 12 months. Equally disturbing, in 2005, the National Survey of the Work and Health of Nurses demonstrated that during a 12-month period, 48.3% were emotionally abused by a patient, 13% by a nurse co-worker, 5% by a physician. In the same study, practical nurses were also consistently more likely to experience a perceived lack of respect compared to other nurses. Need for tools. This evidence speaks to the need for practical nurses and their employers to have concrete tools to prevent and address violence in the workplace. The first place to start in identifying and dealing with violence in the workplace is to define what actually constitutes violence and abuse. The International Council of Nurses has defined key terms as follows. Abuse: behavior that humiliates, degrades, or otherwise indicates a lack of respect for the dignity and worth of an individual. Sexual harassment: any unwanted, unreciprocated, and unwelcome behavior of a sexual nature that is offensive to the person involved and causes that person to be threatened, humiliated, or embarrassed. Violence: being destructive towards another person. Workplace violence: incidents where staff are abused, threatened, or assaulted in circumstances related to their work, including commuting to and from work, involving an explicit or implicit challenge to their safety, well-being, or health. In addition, a great deal of work has been done on horizontal violence in nursing. Horizontal violence: overt and covert non-physical hostility, which can include bullying, criticism, undermining, infighting, scapegoating, and bickering. Harassment and bullying are unacceptable. Examples of harassment are physical abuse, such as unwanted physical contact; verbal abuse, such as anonymous answering machine phone messages, using offensive language or innuendo, telling offensive jokes, name-calling, or spreading malicious rumors. Written abuse, such as letters, faxes, emails, or graffiti, often anonymous, and displaying offensive pictures or posters. Obvious and direct abuse, such as mimicking the effect of a disability or explicit threats. Unseen and covert abuse, such as social isolation and non-cooperation, implicit threats, or pressure for sexual favors. Abuse that occurs at work or outside but is work-related, such as stalking. Examples of bullying are sadistic or aggressive behavior over a period of time, exclusion from meetings, humiliation or ridiculing, criticism in public designed to humiliate, persistent, unwarranted criticism in private, treating colleagues as children. Changing work responsibilities unreasonably or without justification, constantly changing work deadlines or work guidelines, deliberately withholding information to affect a colleague's performance,